Speaker of Parliament Alban Bagbin says the state is unable to single-handedly address the need for ambulance services in the country. At a program to hand over ambulance to the Upper West Regional Hospital, he noted that more needs to be done to augment healthcare delivery in the country. JoyNews' our correspondent Rafiq Salam has more in the following report.
Speaker of Ghana's Parliament Alban Sumana Kingsford Bagbin has averred that the provision of the pre-hospital emergency services in Ghana, particularly in the rural communities, is an essential one that requires urgent attention. Alban Bagbin posited that almost every health challenge originates outside of the hospital, originates at home, the workplace, the recreational center, or when one is in transit from one point to the other. He said the ability to speedily transport members of the community who require urgent medical attention from their location to the nearest health center is a crucial factor that determines survival or death for many of us.
Every health worker knows the effect of the 3 Ds to our survival: decision, delay, distance. These things affect us a lot. Many of us take a long time to decide to access health facilities. You are sick and you will not take the decision to go. It's when you can no longer walk that day now you are carried. That delay in taking the decision affects us a lot. Because the health services are far away, how they have to take you there. If there is nothing to take you, and particularly we look at the rural areas and we see how people struggle with other, these days you have the tricycle, you know, how they carry even pregnant people. It's horrible. And people delivering along the way and all those things. We need to work together to improve this, because you all know that God helps those who do what? Who help themselves. And so we need to work together, wherever, not only in our communities, but also in our workplaces and our recreational center. We need such emergency.
The former health minister opined that effort at nation building and community development are a shared responsibility for all, adding whilst government and state institutions take charge of what is theirs to provide, communities and other significant individuals must also identify their roles and responsibilities in this effort at making life a little more meaningful for all.
The state has proven to be incapable, and that is right. They cannot single-handedly adequately meet the requirements of all communities for ambulances, for hospital-based, other emergency equipment and other services. Hence, my admiration for this very noble gesture of some community members from this region who funded the procurement of the ambulance that has brought all of us here today.
Founder of MIDA Foods, Ransom Khadija, who is the brainchild of the Upper West Region's ambulance project, narrated in detail how the monies were raised and the frustrations in its acquisition.
We raised an amount of 155,500 Ghana cedis as support from 4 sources. Summary of our expenses include getting the ambulance from Italy, 65,000, works and accessories and equipping the ambulance and fixing oxygen installation, 68,249,000 Ghana cedis. Volunteer hours and resources, 30,550 Ghana cedis. It's my prayer that our region takes responsibility of this ambulance, take very good care of it, question its safety if it's seen used for the wrong purpose. This is from people's sacrifices.
Medical Director of the Upper West Regional Hospital, Dr. Robert Amisia, thanked the donors for the support and pledged to use it not only for its intended purpose, but to take very good care of it as well.
If you have one ambulance and it is on its way to Kumasi, and there is another person that has to go to Tamale, you can imagine that you have to wait. We have national ambulances in the system, but they are also busy serving the populations for which they were allocated to. So I think this is a very good opportunity, and I'm very, very happy. I pray for more days like this.